the first thing that I think, where my messaging might differ, and the first thing that I do differently in practice than much of the cardiology community is, blood work is okay, and it gives us some indications, but it really doesn't tell us, do you have heart disease or not? And so one thing that I emphasize to people is, if you want to know if you have heart disease, let's get a test that actually looks at whether or not you have heart disease, not risk factors for heart disease. So the test that I advocate for strongly and use liberally with my patients is what's called a coronary artery calcium scan. And this is a type of imaging study, a type of CAT scan that actually looks at the arteries of the heart and looks for evidence of plaque in those arteries, specifically calcified plaque. So that's really step number one. And then, the primary risk factor for heart disease from a dietary standpoint, or sort of from a physiologic standpoint, I'll say, is insulin resistance. And so the main thing that I'm looking for is insulin resistance. And we can certainly get into why insulin resistance is so important. But study after study, really every study that I have ever looked at that compares insulin resistance to cholesterol levels in terms of their magnitude of risk for heart disease, it's not even close. Insulin resistance is 5 to 10 times more important, more powerful a predictor of heart disease risk than cholesterol levels are. If you have a non-zero score, the goal is you want that score not to get worse over time. And again, cholesterol and a low-fat, low-cholesterol diet is not the answer. It doesn't work. We have plenty of data showing us this, but controlling insulin resistance is what you should be focused on. And the best way we have to control insulin resistance is a low carbohydrate dietary approach. And that includes a carnivore approach. And really, again, there's no reason that we should be fearing red meat or cholesterol in the diet. Red meat has now, again, clearly been shown not to be a risk factor for the development of heart disease. Red meat by itself, I'm going to say. Red meat as part of a Western diet has been implicated in heart disease and many other disease processes. But again, it's not the red meat itself. It's what people are eating with the red meat. The French fries, the soda, the toppings, the bun. That's the real problem. It's not, and it's never been the red meat itself. Insulin resistance, and there are a number of ways that you can look at that from a laboratory standpoint, is clearly associated with not only the presence of disease, but the progression of disease. And again, no matter what your score might be today, if you stop it from getting worse, that's going to put you in a better place. So I look at various markers of insulin sensitivity. You can start with, if all you have is a basic lipid panel to look at, for instance, which some patients are limited to for whatever reason, just look at your triglyceride to HDL ratio. And you want that to be less than 1.5. Anything over 2 for that ratio means that you're likely to be insulin resistant. Now, ideally, you're going to get better markers of insulin resistance. So this starts with a fasting insulin level. And if you have your fasting insulin and your fasting glucose level, you can calculate what's called the HOMA-IR score. And you can, there are numerous calculators online that you can just plug in your insulin and your glucose values. And again, a HOMA-IR score of greater than 2 is an indicator that you're insulin resistant. If you can take it to the next step, even better, is what's called a lipoprotein insulin resistance score, LPIR score. And what this score does is it looks at the size of your cholesterol particles. And I mentioned earlier in the talk how important cholesterol quality is. And it turns out that insulin resistance is the primary influencer of the quality of our cholesterol particles. So Dr. Bill Cromwell was really the one that pioneered this. And he was smart enough to figure out that you can work in reverse. You can look at the size of people's cholesterol particles and use that to determine if they are insulin resistant because that relationship is so strong. And so the LPIR score, I think, is the best practical way for us to measure insulin resistance. And I'll mention kind of what the gold standard way of diagnosing insulin resistance is. It's what's called a Kraft test, but it's kind of an impractical test to do. You basically have to drink a solution of sugar, of glucose, and then you have to measure both your insulin and your glucose levels every half hour for 3 hours afterwards to really, figure out a proper Kraft test. So that becomes a little impractical to do. And I think today, if, what the best lab test is for insulin resistance is the LPIR score.